Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Arteries in the body. What are their functions? Arteries are blood vessels in the body that carry blood away from the heart and throughout the body. There are two types of arteries, systemic arteries and pulmonary arteries. Systemic arteries carry oxygen-rich blood from the left side of the heart to the body by way of the body's largest artery, the aorta. Pulmonary arteries carry oxygen-depleted blood from the right side of the heart to the lungs. /R/N/R/N arteries can be thought of as a system of pipes that branch into narrower blood vessels, called arterioles, until reaching capillaries, where oxygen exchange occurs. Arteries also have muscles that allow them to constrict and widen to regulate blood passage and blood pressure. Several serious conditions affect the arteries, including aneurysms, atherosclerosis, and dissection. This article will discuss arteries, including their structure, function, and ways to keep these important structures healthy. /R/N/R/N illustration by Zoe Hansen for Verywell Health /R/N/R/N. The cells and tissues that make up the body require oxygen and nutrients from the blood. You can think of the heart as a muscular pump and the blood vessels as pipes. Arteries are pipes that carry blood away from the heart, whereas veins carry blood toward the heart. /R/N/R/N. The flow of blood in the body is as follows: after getting oxygen from the lungs, blood travels back to the left side of the heart, where it is pumped out into the body's largest artery, the aorta. The aorta branches into several large and medium-sized arteries that further branch into smaller arterioles. /R/N/R/N. Eventually, blood enters capillaries, where oxygen passes from the arteries directly into tissues. The now oxygen-depleted blood travels through veins to the right side of the heart. From here, it's pumped through the pulmonary arteries to the lungs to pick up more oxygen. The pulmonary veins lead the now oxygen-rich blood back to the left side of the heart, where the process continues. /R/N/R/N. Arteries and veins are both types of blood vessels. However, they have several important differences. Firstly, arteries carry blood away from the heart to the body. For the most part, arteries carry oxygen-rich blood, with the notable exception of the pulmonary artery, which carries oxygen-depleted blood from the right side of the heart to the lungs to get oxygen. /R/N/R/N. Veins, on the other hand, carry blood toward the heart. For the most part, they carry oxygen-depleted blood from the tissues in the body. The notable exception is the pulmonary veins that carry oxygen-rich blood from the lungs to the left side of the heart, which is pumped into arteries to go to the body. /R/N/R/N. Additionally, the structure of arteries and veins has some important differences. Arteries are thicker-walled, muscular tubes that accommodate higher pressures. Veins, on the other hand, are thinner structures that can easily dilate. Also, unlike arteries, veins have valves to prevent backflow of blood. /R/N/R/N. There are several major arteries in the body. The largest artery is the aorta, which carries blood from the heart and travels down through the chest and abdomen, giving off branches that lead up to the head, arms, abdominal and pelvic organs, and legs. /R/N/R/N. The body's major arteries are /R/N/R/N. Arteries are muscular tubes that can constrict and dilate to regulate blood flow and blood pressure in the body. /R/N/R/N. From the outside, arteries look like pulsating tubes. They are often depicted as red in medical illustrations, as opposed to veins, which are portrayed as blue. However, they are a shiny white, with noticeable small blood vessels surrounding them. This is the vasorum, which supplies blood to the arteries themselves. /R/N/R/N. Arteries have three layers, as follows. /R/N/R/N. Various conditions can affect arteries, such as : /R/N/R/N. Aneurysm, a weakened portion of an artery that may bulge outward and burst, causing serious complications like internal bleeding/R/N/R/N atherosclerosis, the buildup of plaque along the inner lining of the artery that is a major cause of cardiovascular death via heart attacks and stroke/R/N/R/N dissection, tear in the intima of an artery, which can impair blood supply to organs and lead to death/R/N/R/N inflammation, aortitis, caused by inflammatory disease or infection and can lead to scarring and aneurysm formation/R/N/R/N. There are several conditions that can affect the arteries, leading to vascular disease. One of the most common conditions is atherosclerosis, which is the buildup of cholesterol plaque, a sticky substance made up of cholesterol, fat, and other components, on the inner walls of arteries. /R/N/R/N atherosclerosis may impair blood flow or clog arteries. It can lead to the formation of blood clots, which may abruptly block blood flow leading to death of the tissue or organ. Depending on the location, it can cause potentially fatal complications such as heart attack and stroke. /R/N/R/N studies demonstrate that atherosclerosis can start as early as childhood, though it progresses and becomes much more common with advancing age. Risk factors for atherosclerosis include :R/N/R/N. The following lifestyle habits are recommended to keep your arteries as healthy as possible, and to prevent cardiovascular disease. /R/N/R/N. If you develop symptoms of a blockage or tear in an artery, it's important to seek medical help immediately. Symptoms include :R/N/R/N. You can discuss with your healthcare provider whether screening for aortic conditions is right for you. For example, the following people are at higher risk of aortic aneurysm, and some guidelines recommend screening with medical imaging such as ultrasound. /R/N/R/N. Arteries are tubular structures that carry blood away from the heart to the rest of the body. System I. Arteries carry oxygen-rich blood from the heart to the body, whereas pulmonary arteries carry oxygen-depleted blood to the lungs to get more oxygen. /R/N/R/N. Several conditions can affect arteries, including aneurysm and atherosclerosis. To keep your arteries healthy, practice healthy lifestyle habits like getting regular exercise, eating a heart-healthy diet, quitting smoking, and treating risk factors like high blood pressure, cholesterol, and blood sugar. /R/N/R/N, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.